Hi, most of the patients who come to this clinic, Springback clinic, have had years of back pain, and usually in their history they've had a very severe rotational fall, either a severe fall on the backside or a car accident or a major fall from a horse or motorbike, for instance. This fall could be at least 10 or 20 years in their history. I'm now going to try and explain to you Springback therapy. It is a trademark treatment. This is a skateboard joint. It moves in 3 planes, and it's very important to note that it has to be centrally pivoted to move in all 3 directions. Once it's off centre, it functions as a stiff joint. This system is the same as the vertebral joints of the back, the disc, facet joints, spinal processes. So they move in all 3 planes, and the whole back should roll along nicely. The problem with the human back is that we went up onto 2 legs, and so we had to avoid rotational accidents. And you can see the facet joints here have come up sideways to avoid rotation, also in the neck. But as we move up the back, it's in the thoracic spine that rotational movement is available. But it is somewhat controlled because you've got the ribs holding the joint in place. So when you have a shunt or a major fall on the back side, it's usually a bit of an angle as you're landing. Bang, it'll swivel up here because that's the first joint to be able to move. And if it's so forceful, it will actually take the muscle with it and beat the muscle reflex. So once you've lost the movement in this part of the back, you'll project all your functional weight on the bottom joints here. You'll occasionally irritate a nerve, and then you'll have an episode of pain, and then you'll twist your back just to take the weight off it. Springback therapy is a method of trying to get the joints back moving again so all the forces can flow through the whole system and rejuvenate the spine. Pounding continues. The joints are under a continual state of inflammation and repair. Ligaments tear and collapse of the disc. Extra bone is laid, cartilage erodes, and for some spines the vertebrae eventually become fused. So then the weight will then go onto the next joint. As the thoracic spine continues to stiffen, there is more stress on the neck joints, and breakdown starts to happen here as well. The answer is to unstiffen the joints. So we come to remobilization. The best way to restore the movement in a skateboard joint is to rock them back and forth through their range of movement. The Maitland technique tries to do this by hand, rocking the joints back and forth with the thumbs. As you see, this is not very clever, as the facet joints are all interlinked. We are talking about joints that have been pre-rotated by a very forceful rotation, probably about 10 years plus years ago. They are well stuck. The spinal joints are much bigger than the joints of the human hand. Any form of twisting on the spine will put all the movement on the unstable mobile joint, not the fixed one. It comes down to the chassis accident of the car. Realigning the tyres with manipulation will only provide temporary relief, and then no help as the tyre breaks down. Observing the protective posture, it's often best to let the spine recover itself rather than tell the patient that the pelvis is crooked and try to forcibly straighten it. So why is air spring technology different? Let's look at the spine. As explained, rocking back and forth does not work. Counter-rotate is the only way. But now the problem is we need something that is strong but safe, but will have to fit all types and distancing of the individual joints. Let's go back to the skateboard. I'm going to use a bag of air pressure to fit the joint and then push through the bag of air. It fits the joint. If I increase the pressure, it just makes it a harder spring, All the push comes from me and I can virtually feel through the air spring. With the mobiliser in action, the therapist allows the air pressure to build up and then pushes through the air pressure. So coming back to the car analogy again, it is like the difference between solid tyres and pneumatic. The skin of the rubber tyre that contains the air pressure. The tyre pressure moulds to the road surface and irons out the rough surface. A solid tyre would not be a good experience. So with this technology, we can introduce a safety mechanism by calibrating a valve to expel the air if we push too hard or the joint resists movement. So with experience, the therapist allows the air pressure to find the next joint distance. The patient receiving treatment does not feel something hard on the back, but a sort of pressure. We now have something that is mouldable, powerful and safe to remobilise the joints. Once the joints can move again, the same pistons can become rapid patellar hammers to restore the muscle tone. Initially, the back has a dead feel, but when the muscles start to reflex and restore their tone, and the joint is freed, leaving a natural reflex to realign the joint, gradually getting a spring back in the spine. If your spinal joints have been freed, we encourage walking more on the balls of the feet, which enables you to use the core muscles to keep the thoracic spine moving, to stop this pounding effect on just a few joints of the spine. It's a bit like having too short a shoe and stubbing the toe with every stride you take. It would be much more sensible to correct the shoe length to stop the stubbing before repairing the toe or try to walk differently to take the weight off it. This would cause all sorts of other problems. If the spine is not remobilised, spinal surgery will commonly be a failure. Hence, a third of the funds in the NHS for spinal surgery is used for litigation.